Hello. Good afternoon, evening, everyone. Welcome to our workshop, OB-GYN Standardized Letter of Evaluation towards a more transparent, honest, and equitable approach. My name is John Dalrymple. I am the Associate Dean for Medical Education Quality Improvement at Harvard Medical School. I also am on the APGO Board of Directors, and I am part of the Right Residents, Right Program Ready Day 1 APGO AMA grant. I'll have my co-presenters introduce themselves as well. Dr. Akingbola.
Hi, everyone. I am Buki Akingbola. I am a first-year resident at the University of Minnesota in the Department of Obstetrics, Gynecology, and Women's Health. I am also the leader of the Trainee and Learner Advisory Group for the RRR grant. So that's me. I'll turn it over to Dr. Whetstone.
Good afternoon. Really excited to be here, touched by how many people are here with us this afternoon. I am currently the residency program director at UCSF and also serve on the APGO Board of Directors with Dr. Dalrymple. We're thrilled that so many of you are here. We're looking forward to a very dynamic discussion. We're really optimistic that you all feel included and feel inspired to participate. So we encourage you, if you are in the space to do so, to turn your cameras on. We have lots of polls. We look forward to a lot of engagement over the chat, and also want to welcome people to unmute themselves when we get to the portion of discussion for our presentation. And without further ado, I'll turn it over to Dr. Dalrymple.
Great, thank you. We have nothing to disclose other than deep passion and excitement about this topic and the opportunity to move and advance the UME to GME transition forward within OBGYN. I'll turn this over to Dr. Akingbola to talk about the poll everywhere.
All right, so throughout our presentation, in order to have a little bit of audience engagement, we have a couple of different poll everywheres at various different points throughout the presentation. So I have put it here in the chat, and also that QR code. If you want to follow along on your phone, you can just go ahead and put it up to your screen and get that from the QR code as well. So we can go, I think the very next slide is our first one, we want to just poll to see who is here in the audience, and I will bring up here our responses so that we're all able to see. Let's see. My titles have gone somewhere here. Let's see if we can go back. There we go. Okay, so I'll give it another minute or so just to continue to see here in our poll. Okay, so quickly in our poll, it looks like we have kind of split as far as clerkship directors and faculty being our biggest representation, and then students or applicants or residents, I should say very specifically, kind of being in the minority here, which I would include myself as a part of.
Great. All right, so just to provide some background, actually, hold on one second. I may have skipped over our goal and our objectives here. The objectives for this session is to really review some of the key components of the OBGYN Standardized Letter of Evaluation, including how to pronounce it. We'll get to that in a moment. Is it slow or is it slow-y? More to come on that. But more importantly, we do want to share our current pilot year's experiences, challenges, and opportunities within the completion of the SLO, and then provide with you some samples of SLOs from this current cycle that have been redacted in terms of who the individuals are, so we can consider how we would use the SLO in the residency screening and selection process. So again, your active participation will be really helpful. So a little bit about the OBGYN SLO, just to make sure we're all up to the same page. It is an evaluative instrument, and this is the very critical part in how it distinguishes itself from the letter of recommendation, which is a recommendation as opposed to an evaluation. If we think about the MSPE, the Medical Student Performance Evaluation, this is similar to that. It is a standardized letter of evaluation, and it's meant to provide a global assessment of our applicants candidacy specifically for OBGYN residency, as opposed to general competencies upon graduation from medical school. In doing so, it provides a standard set of questions and prompts focused on the OBGYN competencies. And these are the same competencies that are used in our residency programs, ACGME competencies, and it is a shared language that we all understand. So we thought it would be of importance to use the similar competencies, which many medical schools have similar competencies as well, to really focus on the evaluation of the applicants. In doing so, the goal is to avoid comparison between applicants. It's really meant to be an evaluation of the current applicant measured against their performance and readiness in those main competencies. In doing so, and this is a critical part, especially in light of what we heard earlier this morning by Dr. Nora Osman, is hopefully to reduce bias and really direct answers to specific standardized questions about the individual students' competencies in the various domains of patient care, medical knowledge, professionalism, et cetera. And in doing so, it limits the wide variation we have all seen in the standard letters of recommendation, which always tend to be glowing, some more than others, but they don't really compare some of the competencies all the time. And this is meant to provide a standardized approach. And in doing so, because it is much more succinct, our goal is that we can promote a much more efficient and holistic review in the application screening and review process. So again, multiple goals for the OB/GYN SLO, and just to make sure we all know what it is. This came about, just a little quick history, through the APGO CREOG Right Resident, Right Program Ready Day One program. It's been in play for a good part of 2 years now. It's a 5-year program. This came out of the Application Review Metrics Working Group, which composed of about 24 members, trainees, clerkship directors, program directors, and other stakeholders. And it was really grounded in work that's been done by other specialties. Primarily the emergency medicine specialty has been using the SLO for many decades and have really refined how they approach it, and it's an integral part of their application process. Just this past year in our own specialty, Gynecology fellowship application introduced the SLO, and we modeled the OB/GYN SLO from these samples. And again, many specialties across the country are actually rolling out a standardized letter of evaluation. We did get feedback this summer from program directors, clerkship directors, and others at a series of town halls and webinars. And just to sort of put it in the greater context of the UME to GME transition, it is supported by recent UGRC recommendations that support the use of structured evaluation letters, or in this case, the SLO. So again, it's meant to really help move the transition forward. So with that, just some screenshots. These are the templates, the forms. Many of you have seen them. They're not meant for you to read them in specific detail, but it's basically a template that's available on the APGO website. It can be easily downloaded and completed. It's in a writable PDF format. The basic structure provides letter writer information, who is writing the letter, how many students they've evaluated, how long they have known the applicant, and more specifically, who, in what context the letter writer is familiar. And one thing that we will talk about is, should this be written by an individual or by a group? And that's something that we will get into a discussion about, but really try to get a sense as to who is writing letter and in what context do they know the applicants. The second part is really the meat of the application, and it really boils down to the competencies that I was talking about. We crafted these competencies to be specific to where a graduating medical student going into OB/GYN should be as they transition from medical school to residency, recognizing that this is not year one residency level. This is at the time of graduation. The competencies are listed here along the side. We split out patient care to include a procedural skills section of the third one down, since that is obviously critical to what we do in our specialty. And then the rating scale, as you can see here, is really meant to be competency based. So where is the student? Are they at, again, in relation to their clerkship year or beyond? We often talk about acting intern level or functioning at the level of an intern. We wanted to have a scale that reflected that, and not a scale that was top 5%, top 1%, middle third, lower third, or upper third. So again, really to anchor it in where the student's level of performance was. And if there was not an observed opportunity for that competency, there was an opportunity to declare that as well. So that, again, this is the scale that we developed. And also I should say, within each of that was an opportunity to provide a small, brief narrative comment to provide an example, which I think was helpful, and we'll see some examples of that. And then the last part, which was a really interesting part we'd love your feedback on, is to provide the letter writer to, in a few words, highlight this applicant's most outstanding feature. Like, what is it about this applicant that stands out? And equally, we recognize that we all have relative strengths and opportunities for improvement, to really focus on what could this applicant focus on in their first year of residency. And we wanted to provide a list of options and then an opportunity to list something if there wasn't any listed here that applied to this applicant. And this was really based on a lot of feedback that we got from many stakeholders about using this as sort of a recognition that not every applicant is perfect without any flaws. We all have opportunities for improvement. And then finally, a short opportunity for a paragraph or two, 250-word limit of anything that you wanted to highlight. Again, we didn't want a 3-page letter of recommendation. We just wanted a paragraph of something that was unique that you really wanted to highlight. So that really is the crux of what the standardized letter of evaluation is. We posted a whole bunch of frequently asked questions and responses also on the website, which is available as a resource. And then from that, what I want to quickly do is now pivot to your experience. Again, we want to know what your experience has been this past cycle with the OBGYN SLO. Who has written a SLO? Who has read one? How are they written individually or as a group? And did some applicants have more? We will get into the details of the SLO in a moment. This is more for us to get a sense as to you all's experience. So let me turn it over to Buki, who will, sorry about that, who will show us what your polls are. So go to Poll Everywhere for this.
All right, so hopefully everyone can see my screen here. I just went ahead and put that link again in the chat for those who may have joined late, but we have a poll everywhere just to get some active real-time responses. And our first question here is, who has written a SLO? Also, I saw in the chat that someone asked about if we have some information about how this was applied this year or what the response rate for SLOs was this year, and we do. So coming attractions here. So this first one, we have about 45% who has not written one or participated in a group SLO. Kind of here are results for that there. We'll go to the next question as well. First, who has read a SLO? Kind of getting some good results here. It's good to see that about 76% have read a SLO. We do have a couple of examples in this presentation as well, so that will be great for those of you who have not yet read a SLO, just to see some of the examples that we have, which are real examples from this year. So that will be great little thing to participate in a little bit later on in the presentation. Moving on to that next question, how were the SLOs written? I think this was an important one and will be really integral to our ongoing conversation about this topic, whether they were written largely individually or as a group. A little bit later in the presentation, we'll be talking about but just kind of best practices for SLOs. And I think it can really go either way as far as doing an individual SLO or a group SLO. And then I think that last question we had is whether or not applicants had one or more than one, for those who had the opportunity to review applications and see letters of recommendations, and whether or not students had SLOs. And so it looks like about 90, in your experience as our audience, about 92% of applicants had one SLO, with kind of the minority here being where people had more than one SLO. So that is just some of our real-time results. Right back to you, Dr. Dalrymple.
Okay, great, thank you. Okay, that's good. It's great to see sort of the experience with the SLO. So one of the questions that came up was how many applicants actually had a SLO this year. Again, it was a pilot year. It was not a requirement. It was something that we were trying out, and it certainly rolled out pretty quickly right on the heels of the application season.
So as we looked at the SLO this year in our pilot year of experience, when we look at individual programs, we saw from the reports of individual programs, anywhere from about 15% of the applicants to up to 50% of applicants had a SLO. When we look at the big group data that we were able to collect collect and get feedback from both Thalamus and Cortex, which comprise about 96%, Cortex specifically, about 96% of all OBGYN applicants, that the response rate kind of on average was about 39%. So those are our numbers for our pilot year experience. I think that was kind of, for a pilot year, I'm personally really impressed. I'm not sure if either Dr. Dalrymple or Dr. Whetstone have anything additional to add to that.
Yeah, that's a good question. Do we think this is a good number for a pilot year, 40%? I'm curious, many of you have been involved, and I know this is a shy bunch, so please don't hesitate to speak up. Is this more than we expected? Not as many as we expected? I'm just curious. Feel free to unmute and chat. David, you're ready to go. Marzano. We're not able to hear you, and that looks like you might be talking. Anybody else? Any other reactions to this?
I hope the numbers continue to go up.
I think yes, I agree. I think John, just a quick comment. Whenever we did any pilot, we usually set kind of what our target is, and we did set a target for this between 25 to 50%. So we're very happy that it came up on the upper end, because we did not expect it to be that high. So this makes us feel that when we make it required next year, it's going to be 100%. That it should not be a problem. And I don't know if you were going to comment on the DOs and IMG at some point.
Yes, towards the end of the discussion about different aspects of this and who may or may not be affected differentially.
Yes, so that's really great for a first year. That means people really liked it. And we heard from program directors, they really, really like it. So
great, thank you. And thanks again to many of you who are part of the SLO team that rolled it out. Many of you who are part of your school's efforts. Those of you who struggle with how to put this together, who supported the applicants, who reviewed them on the program director side. Again, it is a national effort, and it's not easy rolling out something across the country that's new, but kudos to everybody who's been involved in that. I personally think it's an incredible showing this current year. So with that, why don't we move into the next discussion about those who have written a SLO, and I'll turn this back over to Dr. Akingbola.
Thank you. So here, I think as a big part of this workshop, what's going to be really important is talking about the opportunities and challenge that we have with the SLO. This one was also an open response as a part of our poll everywhere. So we will bring up a few of the responses here. So with our very first question of what were the concerns or barriers in writing a SLO, here are some of the responses that we got. It was definitely something that was new. And as the one of the trainees who was on the kind of committee for this, I think this was something that I brought up very frequently, that it can definitely make people really anxious, just as part as being a new part of the application process, and the application process is anxiety producing in and of itself. So definitely can understand and personally relate to that. Some students had more limited data, made it a little bit challenging. We're aware that some people did use this to replace their chair's letter. Concern that other SLO writers may inflate scores for their student, similar to LORs. That's a concern. How to help my students stand out. We're going to have kind of an open discussion piece at the end to hopefully touch on some of these. Some people had no problems, which are awesome, and that's also good to hear. But other concerns that were brought up is when to write it. Is it based on their third-year clerkship or their sub-I? I think that's an excellent question. Also giving that accurate description of students, many people selecting intern, and how to truly showcase a student who's above and beyond, or who we really think is our best candidate. I think valid concern as well. Wanting to promote the student in a positive light and realistic way without harming. We also have a little section here where we'll talk a little bit about the questions at the end, where I can see where this can come into play. People gaming the system via grade inflation and putting all the students in the highest category. Valid concern, that's definitely for sure. Read a lot of SLOs. They were generic, hard to gauge, very fair. Worried that they weren't entirely standardized across institution and or authors. This particular person said they were honest, but not sure everybody else was. And it seems like they saw a lot of intern level across the board. Wasn't clear that it would achieve the objective of less bias assessment. Okay. Took more time to complete than traditional LORs. That's interesting. Okay, also very good to know. So these are some of the big concerns and barriers that came up. Let's see here. What are some of the concerns and barriers in soliciting a SLO? I think I have been most curious to see some of the responses to this. As a department, we elected to write this as a group for every student, so they did not have to solicit a SLO, which I do think was a benefit. I feel like as a recent applicant myself, that's something I would have probably really appreciated. Students were concerned about this replacing the chair's letter with the SLO due to the component of how much time was being spent together, since it would be minimal. Okay. Who is best to write the SLO, either the chair or the faculty? Another piece that we have coming up kind of in our open discussion forum here at the end. Helping students to decide which faculty member should write the SLO, very valid concern. We only had one this year and I did them all based on feedback from many. Okay. They're very generic. I can't tell anything different about the applicants. Some had comments, some didn't, thus de-standardizing it. That's a fair point. I'm really hoping that as we're going into year 2 of the SLO and as we're releasing more recommendations, that this is something we can talk a little bit more about and try to work more on standardizing across the board. Okay, what were some of the positive aspects of the SLO? Someone here said that they felt like it was easier to write and it was specific to what is applicable for residents. Someone said standardization and easier read, more condensed. Nice to have something standardized and specific to OBGYN to use to review applicants. Individual, short and to the point. I think a lot of people like that. Easy to read. A standardized template, allowed for a group response, very direct, simple to fill out, organized, standardized. A great way to establish an internal rank list. Oh, that's interesting, which helped us describe our students and where they're at in their learning. Very interesting point there. More here, just reiterating the standardized point. If there are areas for improvement, it's nice to see those. We should all be improving. I happen to agree with this comment. Directed and comprehensive for a more global evaluation of the applicant. That's great to hear. Efforts to decrease bias are needed. We have to try. I also happen to just personally really agree with that comment. And I, of course, am biased, but I do hope that the SLO in some way can give some part of decreasing that bias here. And I think just this one last question here is just kind of a general poll on who we think should complete this, whether individually as a group. So these are just some of the immediate poll everywhere responses that we got and feedback that we got. I'll kind of turn it back over to Dr. Dalrymple. I'm not sure if we were going to open it up to audience comments for verbal comments, or if we just kind of wanted to go off that.
Yeah, let's go ahead and do that. I mean, we have a very engaged audience. I'd love to have anybody that might feel comfortable sort of expanding on this part that we just saw about your experience in writing the SLO, concerns, barriers, positive aspects of the SLO. And feel free to just raise your hand or just start talking. And please feel free to turn on your camera. Yes, Shireen.
Thanks, John. This was great. We did something similar where we just told the students I'm going to do a SLO for all of you. So I like that other people were acknowledging that kind of made it a little easier for both the students and the writer, because Nadine pointed out that faculty development is going to be necessary to get these done well. And I didn't have the bandwidth to develop my faculty this year, but that's a goal. I also wanted to echo the concerns that were brought up in the comments about kind of worrying about how other people are doing theirs, and worried about seeing so many of these acts like an intern and high level, because I read a lot of them. I wrote 15 of them, I think, and I read numerous. And so part of you worries about that grade inflation, and am I doing my student a disservice by being honest and saying these are the ways that I think that they can improve, and trying to really put them in the appropriate quartile. So I get that.
Thank you for those comments. I think they're reflect sort of our I don't know, our impressions, our expectations, our biases moving into something new, and certainly how our students might be seen compared to others. Again, it gets back to we're all going to do it, and we're all going to do it correctly. It's that sort of getting to that perfect model. And I think that was one of the tensions, is that we knew that we needed to just get this out and get it going, and that yes, this was a pilot year. And I think some schools, and I can tell you at our school, and I saw Dr. Nikki Johnson in the audience, is that we discussed this as a clerkship committee and felt that we wanted to leave it up to the student to decide if they wanted to do it. And again, every school sort of did it a little differently, at least for this initial pilot year. And I think it's one of those things where we're going to now, in just a few moments, shift over to the program director side. And we've been talking about, from the UME side, the writing of the letter, the solicitation of the letter, the transparency of what we put in the letter. Then the flip side is, how does that translate into how the receiver, the reader, the screener, the program director, the review committee looks at this? Dr. Marzano.
Can you hear me now?
Absolutely.
Excellent. I would actually say, as someone who read a lot of slow letters, probably at least 700, that people were honest. I appreciated those people who wrote slows who actually commented on areas for improvement. And those were things that were not held against the applicant, but they were useful to say, okay, this is a person who might have some issue with time management, was one of the areas that was there. I mean, like, that's an overcomable, obstacle, and that's not something that's going to prevent this person from having a residency. So I do think that, as a whole, people did a pretty good job, and there was a lot of variation in where people rated people. They weren't all at intern level. There were some that were at level and such. So, just as someone who saw a lot of the slows, just to throw that out there.
Thank you. Comments are in the chat are great. Will we ever get rid of grade inflation? Again, think about what our fallback is. It is a letter of recommendation. And the question is, what is written in there, and how much additional comments are provided? Any other reactions before we move on?
John, may I make a couple comments?
Please.
Sorry, I'm trying to keep my mouth shut, but I can't. I think that there are a couple of things, because there was a lot of comments in the chat, and I think they're all very, very important points that people are bringing up. I do think that it's important to remember that this is only one piece of the application. This is not the entire application. And this is presenting information a little bit in addition to the letters. And this is why we intended to just keep it one slow, not all of it is slow. That's number one. Number two is that emergency medicine has done this for years and years and years, and it has become a really very important piece of how they review things, because it is criterion based. It's not normative. So for us to go back and say, let's put top third, bottom third, we're not going to do that, because that is not the purpose of a slow. And if we really think, and I saw some comments about people saying that, well, most students fell in the target. Well, you hope that they are, because they're going to be graduating, and you hope that they're actually going to be ready for that intern level, because that's what we're trained them to be. So to actually, if there was a lot of under, I would be actually very concerned about it, because what type of medical students are we graduating? But most importantly is, and I think yesterday, I can't recall who kept saying, oh, it was Star Hampton. I'm saying, give us grace. I think that what I love about this community is the discussions and the conversations that occur. I think we all want the best thing to happen to applicants. And I think that this is why these conversations are great. And I really appreciate all the comments that people are putting in the chat and that they're bringing up, and that we need to keep in mind that everything that we do, we're trying to improve. And if there's something that we're not doing well, we want to hear about it. But we also really appreciate that people are willing to experiment with us. And that's very, very appreciated. And hopefully we can make the whole process better. But I think it's important to remember that's just only one piece of the application.
Thank you, Dr. Hamoud. Really appreciate all of your leadership and insights in this whole effort. Why don't we go ahead and move on to the next part of the presentation, and I'll turn it over to Dr. Whetstone.
Wonderful, thanks. I really appreciate and value this conversation. I know it's important to us all. I think we all hold different positions within med ed, and I hold the role of program director, so I also had the privilege of reading many, many slows. And we're going to go through some examples. We had envisioned doing this in small groups, but we're hopeful to do this in the large group. And as we review the different slows, I want us to think about individuals, is this a positive or supportive slow? Seems like there is a lot of concern that slows may not be positive or helpful to students. And so thinking about, does this slow that we're reviewing actually support the student? How do we respond to those areas of growth, the strength area? Does it matter if one area of growth is checked? Does it matter if multiple areas are checked? What do we do if nothing is checked? How does this slow support our review or assessment for an applicant? And I think it's really important to sort of embrace what Dr. Hamoud was saying, is this is just one piece of a much more comprehensive application. We would love your thoughts on if we think the narrative paragraph is additive or not. You know, as a program director who experienced a significant increase in number of applications this cycle and every cycle in the last few years, does having even more text, is that helpful to us as we review them? Do we find that slows align with other letters of recommendation? Do they add value? And how did we use the slows? Was it just in screening applicants? Was it in ranking ultimately for our match list? And so as we go through the different slows, I'll sort of highlight the key features of each, and then we look forward to this audience reflecting on these questions.
And Dr. Whetstone, before we kind of move on to the next one, I just wanted to bring up some of the responses that we were seeing here as far as those questions that you just posed. So here, hopefully everyone can see this here. We have, what are some of the positive aspects? I think we talked a little bit about this. We talked about this. Here we go. So when reading a slow, is it positive or supportive? Slow. It looks like largely about 67% of those who responded said usually, hopefully they were largely fairly supportive of the applicants. How were the responses to areas of growth in the strength area? Most were vague. Okay. Positives were just as negative. Some were left blank. Fair. Concerned that the PD will read anything negative or not read or see anything about the further about the student. Okay. How does this support or affect your review? For some people, it says that did not help. They were generic. Everyone said intern level, so not standardized. Okay. Could be negative view versus helping the student. So kind of mixed response there. Is the narrative paragraph additive or not? Yes, it is additive, and no, it is not. So just wanted to share a few of these initial responses as we are kind of segueing into this next part of looking at some examples.
Great, thanks for that. Great. All right, so we'll move on to our first example of a slow.
That show up okay?
Yep, perfect. Awesome. So we know the formatting is different, but our previous formatting was too small for any of us to see. So we'll look at this. So this is mock-up number 1. So for the competencies, this individual is at target or post-clerkship level for all the competencies. Some of the comments included, was attentive to asking about family and other factors in patient care and lives, obtained reliable history, took instruction well. By the end of her elective, this individual is able to take more initiative with moving and prepping the patient. Medical knowledge increased as expected. They were eager to help their team and patients. They were an excellent resource for new third-year medical students. They were able to complete assigned tasks, and their ability to anticipate needs and work independently in new situations is still developing. This person makes meaningful connections with patients. They check 3 areas for improvement: fund of knowledge, team integration, and adapting to different environments. The written comments was this individual has a solid work ethic and growth mindset. They will undoubtedly continue to grow in her confidence as she gains more experience. So if you were the PD, the associate PD, a faculty member participating in interviews, a resident participating in interviews, how does this flow affect your assessment of this applicant? Is this a positive one? Does it give you pause? And we welcome your thoughts and feedback on this one.
I just throw out the one thing that I try not to look at slows as positive or negative because they're an evaluation, right? The letters are always glowing, so they're always generally positive. Whereas this is more of an evaluation. It says this is where this student is. So, I just kind of posit that I'm not sure that we should be saying whether, because students would ask, can you write me a good slow? It's like, well, I can write you a slow because you're asking me to evaluate you. There's no good or bad to it. It is what it is. Just throwing that out there.
Great, appreciate that comment. Does this slow then make you excited about this applicant, Dave and others? Does it give you pause?
Sarah, it's interesting because I feel like it's going to depend on what my values are, right? So like, I love growth mindset and I'm going, oh, I love this person. Somebody else might say, well, oh my God, they don't have great fund of knowledge. So, and this is what I love about these is because it's my values, how they align with the value that the applicant is bringing.
Yeah.
I'd also say when I saw people who checked off fund of knowledge, that was a way to go back and look at some other things. Was that consistent with what their clerkship grades were? Was that consistent with what their USMLE was? Was that consistent with their MSPE? Because sometimes it was and sometimes it wasn't. And again, this doesn't give me pause. This is like a typical, I guess I would say probably pretty average student. And average being good because our students are all pretty good.
Yeah, good. Interesting discussion. There's lots of comments in the chat.
I was just going to say, we have a few really interesting comments here coming in the chat. I think especially that someone felt that they were straining to find good things to say, but I think another comment that came up that's a really important point is it would depend on if this was completed before or after the person's sub-I or after their clerkship. So I think that that's a great point. Would you expect something a little bit different if it was completed after a sub-I or clerkship?
And so maybe part of the feedback that we will take is making sure that we clarify when this sort of slow should be completed. Is there an ideal time in the application that this slow should reflect? Should it be after the completion of the sort of clerkship year and more after people have completed their acting internships or sub-I? All right, let's.
Sorry. The other thing I would say, we recognize that this is not fair to be showing you just this snippet because you don't have the entire application. And so the whole point is this is yet but one additional data point to all the other data points that you have before you in terms of how you think about looking at this applicant. And again, if you think about where you might see the slow for the first time, it is often in that first screen. Do I invite this person for an interview, right? And how does that fit into your algorithm, into your holistic review? So one of the questions is, does this help advance your holistic review in terms of looking at this competency assessment in the context of every other data point that you're looking at, all the other letters that are there, the grades, the MSPE, et cetera, the personal statement, et cetera.
Yeah, excellent. Okay, let's move on to another one to see if we can sort of use that to contrast. So this one looks different than our previous one. So in this one, this individual has all at intern level, so functioning almost or at the level of an intern. There are many comments you can see for each of the competencies. So interest in becoming the best provider she can was outstanding. If there were a grade higher than honors, I would give it to her. She was always ready for the day and knew each patient and each answer before I even asked. Her technical skills were above most students I have seen in many years. I am not sure I met a third-year student so well prepared for clerkship, demonstrated an open, receptive attitude towards deepening her understanding of infertility as well as general OBGYN topics, sought out ways to apply her interest and dove into the literature to answer resident level questions, demonstrated commitment to learning about and reducing racial disparities in maternal and infant care, demonstrated resilience and compassion. They have no areas to work on in residency. She is a standout student with exceptionally positive evaluations. So this individual is truly one of the strongest and well-rounded candidates we've had an opportunity to work with in recent history. Her clinical evaluations from both residents and faculty were uniformly outstanding. And so I thought I saw someone mention that, is this true? But this is an actual SLO that someone, that a faculty or group of faculty wrote on behalf of a student. I'm curious as to sort of how people sort of interpret this comment that no, this person doesn't have any areas to improve on, and how that factors into your assessment of the SLO.
If I read this SLO, Sarah, I think the first thing I would do is go look at other SLOs that this person had written, and you know, just to see, is this kind of what they all look like? Because this is, you know, I think this could be made stronger if there were maybe some more specific examples given, but you have to kind of compare the source.
Shireen, I think that's a really good point. So when I'm reviewing applications, I arrange them by schools so that I can look to see, you know, does this person write the same thing for everyone, or is this really a standout student amongst their pack? So you know, I think that's a really good point.
Yeah, it's interesting, you know, the sort of comments in the chat, like, does this actually seem more like a letter of a recommendation than a SLO, where the authors are really just highlighting all the positives about an individual as opposed to potentially assessing all their competencies.
And it's so interesting that we worked so hard to make a criterion-based SLO, and this person's trying to make it normative-based.
Very much so. Dr. Winkle, I see your hand raised.
You know, I think that gets to this thing that I've been sort of just mulling over throughout this process, is like, there is a conflict of interest. We're asking the people who are in the business of selling their students to the residency programs to create this objective evaluation that may feel like it's hurting them. I think we're not going to get anywhere really until it's required. And then I think we should sort of set a standard of what we expect from this, because it is, I mean, it is always going to show the best light, which I think is appropriate. It should be showing the best light. But I think we think there's a problem with the letters of recommendation in that they don't really provide extra useful information. And so I think that we have to think about this in terms of implementation to say, okay, we actually want these are the people we would advise are eligible to fill out a SLO. And this is the process that we're going to use to evaluate SLOs. Like, not everybody from your school is going to be at the same level, and you'll get a friendly chat with one of the people organizing this if they all look the same and everybody's, you know, they're sort of beyond impunity. So I don't know, I feel like there is this inherent tension of like, it's the people who already are in the business of only showing the shiniest parts of the students who are asking to do this. We don't want it to result in negative outcomes for those students, but we do want an honest appraisal.
It was a great summary of the tension I think that this SLO represents. How are we both honest and simultaneously advocate for the students? So I think our goals are very shared.
I think just to add to that, Dr. Jessica Rolfe in the comments and Dr. Sims seemed to agree with this, brought up that it's always good to look for specific examples, because in my head, I'm like, what if this is the most amazing student and or applicant ever? I think going in, of course, comparing it to the previous letters or SLOs that this letter, this person may have written, of course, is great, but Dr. Winkle brings up a great point about, you know, we definitely don't want to be punitive, especially to the amazing applicants that may be out there. But I think bringing up very specific is really be helpful for that.
And also, just to kind of throw out, is that there's still a further opportunity to get more information, because this is probably someone who likely would get an interview, and that is where you might explore a little bit more about, you know, what they may identify as their strengths or weaknesses. So this isn't like the final say in, you know, I saw someone say this person should sit for the boards. Like, this isn't the final say in whether or not she's going to, you know, match it to your residency program. And just going back, it's a piece of the application and a piece of the process.
I also will advocate that we take away the option of none, that everyone has to at least have one area to check off on, and that maybe forcing that individual single choice will at least acknowledge that every student, every applicant, every person does have to grow in some way. Dr. Dalrymple, do you want to advance to our next SLO? Great. So this is something that is similar, but instead of being at intern level, we have above target. I'm curious how people sort of used the above target versus the intern level sort of in their application evaluation processes. Did it make a difference?
I do would agree that comment, again, this is actually great feedback for the next iteration of where the student actually is in their curriculum in terms of having just completed, let's say, a core third year clerkship, if that's when the rotation is, versus have they yet done an acting internship, especially if this SLO is completed in the summer before they graduate. Some may just be completing their acting internship. Some may have had it sooner, some may not have quite yet had it. So I think that sort of shifts what we are describing as target being.
I think another great point that was just brought up here in the comments in the chat is someone mentioned they are suspect when all of the X's are at the same level of performance. So I think that that is interesting and also can lend to this, okay, at what point in the individual applicant's course or career was this filled out? And should that be a red flag of sorts or something to make you pause a little bit?
Excellent. Also, I think, should we be really trying to prioritize active verbs? Was an active part of the operative team? Means like, did you show up and did you operate? How can we help people fill these out to provide more specific examples and more robust details supporting their ratings? Dr. Kumar, I see your hand raised.
Hey, sorry I'm not on video. I'm just not in a good place to be. But regarding that issue of when they're getting their SLO, is there like a standard for that? Because we didn't use them this year, but we plan to next year. And I feel like my reaction would be very different. And then second, at our institution, we have internal students and a huge number of visiting students. So are people just doing this for their internal students and not their visiting students? And then often they're in subspecialty rotations. So who is that team of people to evaluate them? That's like 7 questions. You don't have to answer all of them.
But it's also going to lead us to our discussion at the conclusion. So we're just going to look at a few more SLOs, and then we will return to your questions because I think they're really important and critical to how we fill these out. So again, here is a SLO where the rankings are not all at the same level. You have a mixture of above target, and potential for growth. And I can reflect as a program director, I saw almost no potential for growth ratings. And I'm curious if other people had similar experiences and then how you then utilize that potential for growth in sort of considering applicants. Someone privately shared that this might have been one of theirs, but we appreciate the honesty. If no one has any thoughts on how they use this, did you interpret the different areas for focus differently? I know that I had residents involved in application review, and they had very strong feelings on which areas of focus were worse than others. And I'm curious if other people had similar thoughts or if it was just that, everyone had an area for growth.
Sometimes I think it's the number of areas for growth. So, if there's multiple areas for growth, that certainly is a concern. Particularly, team integration, like basically can they work well with other people? Because that can be a problem that's hard to teach someone over time. And identifying that early on is a good thing. So, I really, again, in the context of everything else, is part of the interpretation, and this is just one of those pieces.
I think our residents and reviewers, when they saw situational awareness as an area of focus.
You put yourself on mute.
I'm sorry. The situational awareness as an area for focus was a big hot button for several of our residents.
Yeah,
I
for
will just-
mine, it was being prepared for patient care, but it was very interesting how strongly they felt. I'm sorry. Go ahead, Vicky.
I was just going to say, as a trainee, but thinking back to when I applied about a year and a half ago, I think as a applicant, it would be hard to get this back and have something like situational awareness or team integration. I think maybe for me would maybe be another one. Yeah, this is the part of the slow, I think, as we were kind of creating this and talking through it, but I think can be tough. I do think if you sit and talk with the applicant about it, of course that makes sense, but I would be concerned about how programs that evaluate my application as a whole with also potentially having one of these checked. But I think that's part of needing to settle into being comfortable with talking about areas of improvement and places where an applicant would need to grow.
I think this also moves us towards, because there were a lot of comments earlier about red flags and code language, and I think as PDs we all know what we perceive as being the codes and traditional letters of recommendation, and yes, they get embedded in some of the comments here, but the objective things that people have to check then kind of, I think, helps to neutralize a little bit of those things, because it gives us a concrete thing so that we are all using the same language, instead of, you know, a letter writer who may not realize, you know, who's maybe a new letter writer who doesn't know what the codes are and uses the word solid, and they think that that is a really good high praise word, whereas a program director might be like, solid, okay, that's all right, not great. And so, you know, I think, you know, kind of using the check boxes and again the actual target things is a helpful thing to help overcome some of those codes.
Excellent. And just in the interest of time, I want to make sure that we have enough time. So John, why don't we move to our last slide to give space for some of the discussion points that we really wanted to make sure that this group tackled.
Sounds good. So I think at this point, thank you all for that conversation. Again, we try to highlight the range of what the slows look like. I'm sure there's probably more slows that looked more similar, and one of the other evaluation aspects of the slow pilot this year is to try to dig a little deeper and see what percentage of slows were filled out at all of above target or intern level, et cetera. So we're trying to get a little bit more information about that. So more to come on that. But again, it's really, I think, helpful for us to see what people write, how they write them, and then again, on the receiving end, your reaction to it as a program director or as a faculty who is screening residents for application, or screening applications for residency. So for the remaining 7 minutes, we wanted to sort of dig into some of these questions about what other resources programming communication would help for an implementation adoption perspective, as well as for completion of the slow. And I think we've heard a lot already that faculty development is key. Centrally, through APGO and the grant, we want to be able to put together resources and information, make those readily available on the website, conduct more webinars or workshops as needed. And it would be really helpful if we could hear what would help advance the slow moving forward. The discussion, and let's take each one of these bit by bit, but the second part about who should compose the slow, I think it gets to the part of who knows the students the best, and because it is competency based. I saw a chat earlier about, is it clerkship assessment or is it sub-I? And I think it's really where they are ready for the transition. So if it is competency based, is where are they today based on how they're assessed? And often that would be at a sub-internship or clinical elective, which then begs the question, who should provide that input? Who has directly observed the students? And I think this sort of underscores the criticality that the challenges that many of us have at our medical schools about who is observing, who is assessing the student, and is there enough eyes on the student in terms of looking at these particular competencies. And then finally, how is it used to augment the MSPE? And then a very important aspect, a very important cohort of our applicants, the DO students and the IMGs. And just to kind of get to that point, I think for many students who do not have a home department or a home clerkship who do these away, we would say that it's whoever has worked with the student and knows them the best, and that may be a faculty precept, an elective at an away rotation. So open it up for conversation. Feel free to take any of these questions. Let's begin with the first about resources and faculty development. What would be helpful?
I think this means that you guys did such an amazing job with resources. You know, I was really impressed. I tried to attend everything and look at everything, but I was really impressed with the webinars, with the sort of tip sheets and the whole kind of section on the APGO website, where you could go back and look at the documents. I could send them out to my students as a reminder. I could refer back to it when I wasn't sure. So I was really impressed with the organization and the transparency and all of this sort of educational information that was provided. It may be that based on some of the suggestions here today, there will be, you know, new things for, I'm sure you'll be refining, the group will be refining everything, but I really thought that the resources were a highlight of this attempt. So thank you.
Yeah, I think the comments, and thank you, Dr. Schaefer, about instructions or definitions of what target is. What do we mean by that? It really is about everyone having the same shared mental model by these different categories. And what does that look like? And again, every school, every program, every individual faculty has their own perspective. And to the point, somebody just wrote about, I think Dr. Ralph, about private physicians who may not have the same perspective or viewpoints based on either the range of students that they see or where they sit may affect how they complete a SLO. So again, there are certainly some inherent challenges, I think, in that part, but trying to standardize the process and the definitions, I think, is an opportunity. Why don't we move then to sort of who should write the SLO? A lot of conversation about it being a group SLO, replace the chair's letter. Anyone want to take a stab at sort of their perspective, and we will wrap up with our recommendation for our guidelines moving forward.
I just want to throw out there on the question about it, whether it should be individually as a group. We have as a group winning out at 62% of the people who responded saying that it should be written as a group versus 38 who said it should be written individually.
Great, great. So just to kind of cut to the chase, I don't know if Dr. Hamoud is still with us, but I see Dr. Morgan is still here, and Dr. Winkle and many others as part of the grant team. We've had discussion of how do we move forward for this next cycle, because it is upon us in the next couple of months. Our proposed guidelines at the moment, again, this is just being aired. It's going to be ready for prime time at some point, but we don't believe that it should be SLOs replacing all of the LORs, that there is value, and we've heard this, there is value in a letter of recommendation because different aspects are addressed about the applicant. If the SLO is meant to be the evaluation for competency with the right input by the group, by the faculty who know the applicant, that one SLO should provide that information. There is room for individualization vis-a-vis the letter of recommendation. And there is also some value of the chair's letter. Many would say, well, shouldn't the chair's letter be the SLO? Again, this is just a model that we are proposing. I'd love your feedback and thoughts in the final minutes about this moving forward, because we are going to have to lay out some guidelines for this coming cycle.
I put it in the chat, but I'll just say it quickly out loud. I mean, I think we could say some flexibility there of like, the SLO can replace the chair's letter. And like that's an incentive to use it and do it. A lot of times those letters aren't written masterminded solely by the chair. Sometimes they are, but then chairs who love writing those letters could keep writing a chair's letter and the school could do it separately. But it sort of also underscores how important it is and how much it's like this school is giving this student this stamp of final standard evaluation.
I do feel like the SLO will be most useful to us if it's written by someone in leadership that's gotten some guidance on a SLO. I think I saw a few SLOs, and probably everybody did, that were written by faculty that may not have had as much guidance with regards to what we've talked about this past hour.
Great, thank you. Clearly, we could go on all night, but we are at time. This conversation will continue. Please, any thoughts, feedback, please keep it going in email communication, certainly on the platform when we meet again through the FDS in the coming weeks. Just quick reaction. What is your overall impression? Put your camera on, put something in the chat. How are we doing? We getting there? Maybe, sorta. See a few thumbs. Well, as we wrap up, definitely want to thank everyone for your participation tonight, for all the work that you've done to support our students, to support our clerkship directors, our advisors, our faculty, our program directors, our chairs. Anytime we do something new, as you all know, organizational change, system change is hard. We deeply feel that this will move us in a better direction. So thank you all for all your work. This will continue to evolve, and we're very fortunate as a specialty to have such a dedicated group of faculty and educators who are committed to our students and future OBGYNs. So with that, thank you all. Have a good night, and let's stay in touch.
Thanks, everyone.